John, where are we in the chase for the vaccine?
I've never seen a more rigorous chase for any vaccine. There are over 70 efforts underway right now. 5 have already started clinical trials. And the clock starts on January 10th when the virus is first publicly described with the sequence. That's a remarkable period of time. I mean, from now to then, I've never seen anything like this. So there's a tremendous amount of activity. There's a lot of investment. There are a lot of very smart people trying to do it. But, the question you're raising is, when are we going to be able to go to a movie theater with the vaccine in our bodies and feel great? I don't know. Nobody knows. And anyone who tells you they do know isn't telling you the truth.
And in the competition, is this a competition, or is this kind of a cooperative effort among different researchers on getting to a vaccine?
I think there's a remarkable attempt to coordinate this and to collaborate. Scientists don't always get along and don't always collaborate. There always is competition. Some of it's healthy, some of it isn't. We have to wait and see. Right now, I see several organizations attempting to organize the field. But it's going to be a big question how you narrow down from more than 70 to 1, 2, 3 that are going to be produced. I mean, I don't know in the end how many will work. I don't know if any will work. I'm hopeful that that we'll have a vaccine. It doesn't look like that tough of a scientific nut to crack. But there's a lot of uncertainty, and that's hard for people to accept, but that's reality.
And if we get to the point where that nut has been cracked, as you put it, and there is a vaccine, and it's a vaccine that seems very reliable and actually gets to the point of being proven to be reliable, how do you scale up the manufacture of that to deliver it not just to the 330 million Americans who want it right away, but the whole world wants it right away?
Yeah, that's a huge challenge. And people are fortunately putting some thought into that now. Bill Gates has talked about even financing building plants for vaccines that never get made so that that problem doesn't occur. Questions of equity and access are going to become real if there is a working vaccine. There are big pharmaceutical companies in the game. There also are some old-fashioned technologies that are here that most everyone could do. So we have to just wait and see what proves effective. I think it's important to talk about it now because equity and access are hard to talk about after the fact.
Well, I mean, equity, if we just looked at it in national terms and didn't think beyond our borders and, for example, how African countries can possibly compete with us to get the vaccine, just within the United States, how long do you think it would take to get from the privileged, where it would surely begin in terms of distribution, all the way through to the poverty population of America?
I've never seen anything hit the entire world the way this virus has hit it. And maybe climate change has, but some people don't even believe in that. Everyone believes in this virus. I don't think we're going to be able to silo ourselves like that as the United States. So let's just say, what's the timeline for any country, and it could well be China, to make a vaccine and prove that it works? The estimates are at least a year if everything goes well. I've watched a lot of vaccine development. Things don't go well most of the time. There are small problems that crop up, even with something that's a good vaccine. So say it's a year, say it's 18 months, and that's optimistic. There are attempts to speed things up more quickly, to take some shortcuts. They're inventive, and they could work. But we're talking big gambles.
And let's say the vaccine's developed. Does it take another year after it's developed for it to be distributed to all Americans, or more than a year?
Not necessarily. I mean, we could ramp up production depending on the technology that's being used. We could ramp up production to hundreds of millions, if not billions of doses, if we prepare properly. And I think the discussions are happening now. I'm heartened to see that. But, I'm a skeptic. I think we have to remain skeptical about this until we really see the plants are built and are running and people are doing these things. Lots of little things can trip up production of a biological product like a vaccine. This isn't making a drug with chemicals. It's taking the virus, reformulating it in a way that it helps us rather than attacks us.